Hello dear viewers, this video, that is Trichomonas Vaginalis, a flagellate parasite. This has been made with the intention to make general public aware about this infection and the causative agent of this infection, that is Trichomonas Vaginalis. This parasite lives in the reproductive and urinary system of people. It is obligate parasite, that is, it cannot live without close association with vaginal, urethral or prostatic tissues. It infects squamous epithelium but not columnar epithelium. High incidence of symptomatic infection is seen in women than in men. Zinc and other inhibitory substances probably inhibit their growth in men. It is a sexually transmitted disease which is worldwide in its importance. This infection is cosmopolitan in distribution, that is, in every part of the world it is prevalent. However, prevalence is not uniform because of sanitary and hygienic habits. That is, in developed countries, it is not so prevalent as is it prevalent in third world countries. It is 20 to 40% in women and 15% in men. It is pathology. In women, we see asymptomatic in most cases. Vulvovaginitis is a condition where there is purulent vaginal discharge or leukorrhea, a pus-like discharge is there, malodorous smell, strawberry cervix, punctate hemorrhages in mucosa, vulval and vaginal epithelium fiery, red and inflamed, dyspareunia, that is difficulty or painful sexual intercourse, urethritis, dysuria, painful or difficult urination, increased frequency of micturition, that is action of urination. In men, it is usually asymptomatic. Non-gonococcal, that it is not caused by a gonorrhea-like infection. It is non-gonococcal urethritis. In this case, what we see? Pain in urethra, testicular pain, purulent to mucoid discharges. That is, after urination, a discharge seems to be there. Epididymis, prostatitis, superficial penile ulceration. Epididymis is a fat-like lining about the testis. Its characteristics. When there is natural flora, bacterial, in the vaginal part, it keeps vaginal pH 4 to 4.5 and ordinarily this discourages the infection. Trichomonas vaginalis can survive at low pH. Once established, it causes a shift towards alkalinity, that is pH 5 to 6. It increases, which further encourages its growth. It is a dangerous infection. How we diagnose it? In case of women, through a vaginal discharge, through endocervical specimen. In men, urethral discharge, prostatic fluid, early morning first void, urine sediment or semen. Early morning first void or urine sediment is seen under microscope after centrifugation. If it is fresh urine, we can see an alive parasite there under the microscope, 40x particularly. Parasitic diagnosis, that is method of examination. First of all, it is microscopy. Under 40x we see it. Then when we go further deep, we can take culture. Then antigen detection, that is through ELISA. Serodiagnosis, it is limited, that is through serum, it is not diagnosed. Another thing is molecular diagnosis, where we see DNA probes, more sensitive and highly specific. PCR, that is polymerase chain reaction, that it is a DNA related test, high sensitive and specific test, where genes of these parasites can also be detected, that is it present or not. Treatment is particularly it is metronidazole. It is highly effective against this parasite. It gets killed by this metronidazole. Clotrimazole is also. Detection and treatment of cases both partners. Avoidance of sexual contact with infected partners and use of condom. We can protect ourselves from this kind of infection. So it is necessary and important is that a care needs to be taken there so that we can protect ourselves from this kind of infection.